Many people ask me what the difference is between getting PRP just in the knee joint itself and getting PRP in the knee joint as well as the ligaments and tendons. And I thought I would try to differentiate that. And so there are several institutions now, because PRP is becoming very popular, that will inject PRP, let's say in a knee joint, okay? And when they do that, they will inject it in the joint itself. And that's helpful, there's no question about it. But the problem is what happens if you have an unstable joint as well. You basically have two bones in the knee, okay? You have your femur, you have your tibia. Then you have a little bit of fibrocartilage, what we call a meniscus. Well, if we just had that alone, they would come apart. So you have to hold them together. And so there's four main ligaments that we look at. We have the medial collateral ligament, which is on the inside of the knee. We have the lateral collateral ligament, which is on the outside of the knee. And then we have our cruciate ligaments, which are inside the knee. And all of these ligaments have a specific function. They keep the knee from going back and forth or from side to side, because really the knee is a hinge joint. It doesn't want to do all this kind of stuff. When it really starts rotating is when we get into a lot of problems, particularly like meniscal tears. And so when we do PRP, we not only put it inside the joint, that is important. It does help some from an articular standpoint, and it also helps calm the joint down. Very effective. However, you're only getting half the benefit. So why not inject the medial collateral ligament, the lateral collateral ligament, as well as the cruciates? And if you need any tendon, if you have any tendinopathy or little tendon tears, get that as well. And so if you use PRP both intra-articular as well as extra-articular, you're going to get a better outcome. And many people come to us that have had meniscal tears and had a meniscectomy, which is this piece of the meniscus here is taken out. Well, what happens to the joint dynamics when that happens? Well, you're probably tilted just a little bit, and through time, the center of gravity shifts and you'll wear one side out a little bit more, and it can lead to a decrease in the joint space. Or some people will come to us with severe osteoarthritis. So let me just show you what happens when you take that meniscus out, okay? So we take this meniscus out here, okay? This may be an extreme example, but it goes to the point. So look at what happens. Here's where your knee was. Here's where your knee is now. Look at what happens to these ligaments. They're lax. They're not tight anymore like they were when you had a good volume joint space. And so if we just put PRP inside the knee and don't fix all that instability, yeah, it'll help, but it's not going to help nearly as much as if you put PRP inside the joint, take care of the ligaments and tendons to try to stabilize that joint in the position it is now. And so that's the difference between just putting it in a joint, which again will help, or putting it in the joint and also tightening up the surrounding structures.